In this video, we're going to be talking about mistake number 2 of the 3 most common mistakes practitioners make when launching a functional medicine program. If you haven't already seen the first video of this 3-part series, make sure that you watch that because these kind of all play together. So this second mistake that we see practitioners make and how to avoid it is the mistake of failure to launch. So what do we mean by that? When we talk about failure to launch, obviously, there are a lot of practitioners out there who have attempted to build and or launch a functional medicine program that haven't, but there's a specific type of failure to launch that we're talking about. This is a very common scenario. In fact, I'll tell you a story that represents countless other stories. We were on a discovery call with a practitioner whose background was incredibly extensive in functional medicine training. They had been through just about every certification course and every deep dive program out there that you could imagine. They knew everything from a textbook landscape in terms of all of the different labs you can run, all of the different conditions and problems that were out there. Quite frankly, they were probably smarter than all of us at Simplified Functional Medicine when it comes to a deep dive knowledge of functional medicine. The problem, however, though, was when we talked to them about implementation or launching of functional medicine, they had yet to actually launch their functional medicine program into their practice. Reason being is because there was still a significant gap between the academic textbook knowledge that they had learned over the years and what it actually takes to implement and launch in the real world and actually start working with and helping patients. And so if you're hearing this and this is resonating with you and this is a common kind of sentiment, frustration, concern that maybe you have, it's because this is a common mistake that practitioners make is failure to launch. They get stuck in kind of this spin cycle of learning but never implementing. And so this is, again, not only one of the common mistakes, but it's a relatively easy fix. And this is the philosophy shift and change that we have taken inside of our Simplified Functional Medicine program, where learning is doing, or doing is learning, if that makes sense. And so our program is designed to get you up and running fast, not just from a so you can start making money standpoint, but so you can actually start really truly learning what it takes in the real world to start helping people solve these common chronic health issues. And so we're very much about learning by actually doing. And that's one of the cool things about Simplified Functional Medicine is that the protocols that we use are inherently safe, such that a relatively inexperienced practitioner can actually start helping people really quickly. Because again, the things that we are doing are incredibly safe. They are inherently focused largely on lifestyle factors, intrinsically motivated or mediated strategies to get patients engaged in their own health. And it's by the doing that the learning takes place. This is the biggest kind of hopefully paradigm shift and epiphany that practitioners will make, is that if your program isn't such that you can start learning by actually rolling up your sleeves and getting in and talking with patients and working with patients and learning through that experience, you're going to largely, I think, never get the confidence and thereby competence. There's this idea of a confidence competence loop. It's this infinite loop, right? Where as your competence increases, your confidence increases. As your confidence increases, it feeds into the competence, and so on and so forth. And so the mistake, again, that practitioners will make is in thinking or believing that you have to acquire a certain number of hours or you have to get some sort of special credential behind your name in order for you to actually step in and start helping people. And nothing could be further from the truth. There isn't an extensive amount of hundreds of hours of education that you have to accumulate before you can actually start making a pretty significant impact in people's lives and changing their health for the better. And so this is one of the things that, again, that we have really figured out inside of Simplified Functional Medicine. One of the most unique things about our program is that we have an incredible provider network and community. Each week, we gather on what are called CSD calls. This stands for Case Study and Design. And so you can learn very quickly on the fly in the real world by seeing real world cases submitted, including your own. So what you can do is submit your own cases with patients that you're working directly with and get live feedback on the fly, so to speak, so you can learn in real time what it really does take to help start solving these problems for patients. And so the mistake is failure to launch. How to resolve it? You launch, and you launch as quickly as possible, and that's what we're here to help you with. The next mistake that we're going to be talking about on the next video, the third mistake of the 3 mistakes, is a failure to provide a complete solution. And so we're going to be talking about that on the next video, so make sure to check that out. Also, if this is resonating with you and you want to learn more, watch our on-demand training and or schedule a discovery call, and we look forward to sharing that information with you as well. So thanks for watching. We'll talk to you real soon.